Hi everyone, welcome back to my channel. And if you are new here, welcome. This is Hoàng, the coding expert. In this video, I'm going to share a clear and practical roadmap on how to pass any medical coding exam in 2026, whether you are preparing for the CPC, COC, CCS, CCS-P, or CCA. It does not matter whether your exam is from AHIMA or AAPC, the foundation and the strategy are the same. This roadmap is based on real-world coding experience and many years of helping students successfully pass the exams. So, without further delay, let's get started. Let me start with one important truth. Passing a coding exam is not about how smart you are. It is about having structure, consistencies, and the right strategy. These exams do not test luck. They test whether you understand guidelines, logic, and whether you can manage your time under pressure. Exams change, principles don't. I want to address a question I receive often on YouTube. Many of you ask whether my videos from 2024 and earlier are still valid. The answer is yes. Every year, codes change, and guidelines may be updated, but the core principles do not change. What truly matters is learning the concept, the approach, and how to tackle case-based questions, including the tips and strategies I use, not just memorizing codes. Whether your exam is from AHIMA or AAPC, they all test the same fundamentals. It is testing whether you understand the guidelines, whether you can apply logic, and whether you can manage your time. If you rely on memorization or guessing, you will struggle. But if you follow the guidelines, think logically, and control the clock, the exam becomes manageable and passable. Know your IC10CM book. On this slide, I want you to focus on understanding the format and convention of the IC10CM book. This is something many exam candidates overlook. IC10CM is organized into 3 volumes, and you must know the difference between them. Volume 1 and Volume 2 are used for diagnosis coding. Volume 3, which is IC10-PCS, is used only for inpatient procedure coding, and it tests on CCS exam, not outpatient exams like the CPC. When you look up a code, always start in the alphabetic index. Use the main term first, then follow the subterms carefully, but never stop there. Your final code must always be confirmed in the tabular list. Pay close attention to phrases like code first, use additional code, and with or without. More exam mistakes happen because you skip this step. You also need to be comfortable using the neoplasm table. Know how to assign codes based on whether the neoplasm is primary, secondary, in situ, or uncertain behavior. Finally, understand how to use external cause codes. These are especially important in accident cases, and you must know how to look them up correctly. If you master the book structure and convention, coding case become much easier and much faster. Know your CPT book before you look up any CPT code. You must first know the format and convention of the CPT book. That includes understanding how the book is organized, the meaning of CPT symbols, and the different code categories, including Category 1 and Category 3 codes. When you begin coding, start with the CPT index. Use the main term first, then narrow your search using subterms. The index helps you locate possible code range, but it never gives you the final code. Once you find the code range in the index, move to the main CPT code section, which is arranged numerically. This is where you verify the final code, read the full description, and confirm what work is actually included. Before selecting any CPT code, always read the section guidelines. Guidelines come before code selection and explain how codes are intended to be used, what is included, and what is excluded. Pay close attention to parenthetical note and CPT symbols. These notes often tell you when a code can or cannot be reported, when a modifier is allowed, or when another code must be used instead. You must also understand the difference between add-on codes and standalone codes. Add-on codes can never be reported alone and must always be linked to a primary procedure. Finally, confirm whether services are bundled or separately reportable. Just because a procedure is documented does not mean it can be coded separately. Following this step-by-step process will save you time on the exam and help you avoid common CPT coding mistakes. Master 2026 IC10CM Official Guidelines. This step is critical. Start by understanding the convention and the general coding guidelines. These tell you how the IC10CM classification works and how codes are intended to be applied. Next, focus on the chapter-specific guidelines because this is where many exam questions are designed to trick you. Pay special attention to important chapters such as neoplasms, diabetes and hypertension combination codes, coronary artery disease, and myocardial infarction, sepsis with severe sepsis, HIV, adverse effects versus worsening, and pregnancy, childbirth, and the puerperium. Sequencing is extremely important. You must apply the correct sequencing rules because the first listed diagnosis code determines whether your answer is correct or incorrect. Always follow the chapter-specific guidelines when deciding what condition is listed first. Also, make sure you assign laterality correctly and clearly understand the difference between exclude 1 and exclude 2 nodes. If you follow the guidelines and sequence correctly, you can easily eliminate incorrect answer on the exam, even when the question looks complicated. CPT coding guidelines. When it comes to CPT, remember this. CPT is understanding the procedure, not guessing the code. Before you select any CPT code, always read the section guidelines first, whether you are in surgery, medicine, or radiology. These guidelines tell you how the codes are meant to be used. You also need to understand bundling rules, how add-on codes work, and the intended behind modifiers. Modifiers explain details such as who performed the service, what was done, where it was done, why it was needed, or how it was provided without changing the main CPT code itself. Also remember that codes change and some rules change, so you must stay updated with the current year's CPT book and guidelines. The exam is testing whether you understand what work is included, what can be reported separately, and what is considered bundled. When taking the exam, if you know and follow the CPT coding rules, you can eliminate incorrect choices and the correct one becomes clear. Medical terminology and basic anatomy and physiology. You need to understand medical terminology. Knowing common prefix and suffix helps you break down medical words and understanding their meaning even when you see a term you never seen before. You also need to understand body system and what each system does. This gives you the foundation to know where the problem is and what is being treated. Knowing basic anatomy helps you code procedures more accurately, especially for surgical cases. It also helps you understand the rational terms and how organs relate to one another in the body. When you understand anatomy and physiology, you can better read and understand operating reports, code surgical cases more accurately, and eliminate incorrect choice faster when taking the exam. Reverse analysis. This is my signature technique and this is one of the most important strategies for passing the exam. Reverse analysis. I actually developed this technique when I was in college because I realized I didn't have enough time to read every case from start to finish. On the exam, you usually don't have enough time to read the entire case first. And even if you do, if you don't have a strong surgery coding background, the description may not make sense yet. Instead, start by analyzing the answer A, B, C, and D, not the question. Group similar answers together. Then look up answer choice in your CPT book. When you read the code descriptions, they help you understand what the procedure or surgery is really about, and you begin to see the key difference between the codes. Now, and only now, go back and read the case. Look for details that match what you saw in the CPT description. For example, after reviewing the CPT description, you may notice that one code is for open procedure and another is for percutaneous procedure, or one code includes imaging guidance while another code does not. When you go back and read the case, you are not reading everything. You are looking only for those key details. Once you see whether the procedure was open or not, or whether the image was used, the correct code becomes clear, and you can match the case to the best code. By doing this, you are not guessing. You are using the book to guide your thinking, and the correct answer becomes clear. Now, let's use this case to walk through my reverse analysis technique so you can see exactly how it works step by step. Before we start, let's pause for a moment and look at this case as a whole. It's a long paragraph. There are many details, and there are a lot of codes in the answer choices. Now, think about the CPT exam timing. You have 4 hours for 100 multiple choice questions, which gives you about 3 to 5 minutes per question. Just looking at this case already makes me feel anxious and nervous, especially with the clock ticking. Most people would normally start by reading the question first, trying to understand the case, then opening the book to look up codes. But by the time you finish reading, searching, and flipping pages, 5 minutes may already be gone. So, I want to ask you, how do you normally tackle a case like this? Do you have a technique you use? If you do, feel free to share it in the comments so we can all learn from each other. Now, let me show you my technique called reverse analysis, or you can think of it as a backward approach. With reverse analysis, you do not start by reading the question. Instead, you start by looking at the answer choice A, B, C, and D. First, group the answers. You will notice that A and C both contain the same code, S52.351B, so they belong to one group. Then you will see that B and D both contain S52.351A, so they form another group. Now, you have two groups in two different codes, S52.351A and S52.351B. Your next step is to open your IC10CM book and find the difference between these two codes. When you look them up, you will see that S52.351A is for a closed fracture of the shaft of the first metacarpal bone right hand, and S52.351B is for an open fracture of the shaft of the first metacarpal bone right hand. And for those of you who have been watching my videos and taking notes, you should already recognize this pattern. For fracture code, the 7th character A is used for initial encounter for a closed fracture, and B is used for an initial encounter for an open fracture. Knowing this right away helps speed up the elimination process on the exam, and sometimes this alone can help you narrow down the correct answer. Now you know exactly what to focus on, and this is the right time to start reading the case or operating report. A patient presents to the emergency department after falling from a ladder at home in the yard, landing on the right hand. The doctor documents a display fracture of the shaft of the first metacarpal bone of the right hand. The question clearly states this is an open fracture, so you can automatically eliminate answer B and D. At this point, only A and C remain. When you compare the remaining codes, the next three diagnosis codes are the same: S61.411A, F50.11XA, W11XXA are the same, so they do not help you eliminate anything. The only difference left is the place of occurrence code. Answer A lists Y92.015, while answer C lists Y92.017. So now, open your book again and look up these two codes, and hear what you will find. Y92.015, private garage as the place of occurrence, and Y92.017, garden or yard as the place of occurrence. You will find that Y92.017 represents the yard, which matches the documentation. Falling from a ladder at home in the yard. That said, the correct answer is C. This is reverse analysis. You use the answer choices to guide your thinking. You read the case with purpose, and you save time without guessing. You don't need to look up codes for the laceration of the right hand, the contusion of the right elbow, or the fall from a ladder, because you already identified the correct answer using my signature technique, reverse analysis. Let's talk about how to prepare your mind and routine so you can apply this technique under real exam pressure. Study discipline and focus. To pass the exam, you must set a fixed study time every day, the same hour and the same place. This helps train your brain to focus automatically. Studying 45 to 60 minutes daily is far more effective than studying 5 hours once a week. Remember, consistency is the key. It is how small daily study turns into big results. When you study, eliminate distractions. Turn off your phone, turn off notifications, or do not multitask. Study with only what you need: your coding books, a notebook, a pen or pencil, a highlighter, and maybe tea or coffee. Think of studying like training for a marathon. You don't run the full distance in one day. You train a little bit every day. That daily practice builds your endurance, your confidence, and your knowledge. And when studying becomes your routine, it starts to feel natural. This is what allows reverse analysis to work for you on exam day. Because you have trained your mind this way, you can stay calm, think clearly, manage your time, and apply the technique confidently, even with the clock ticking. When you use my videos, use them strategically. Don't just watch with a purpose. Choose videos that match what you are studying, such as ICT-CM guideline, CBT section, or specific exam topics. Watch actively. Take notes while you watch. Pause the video, stop and think about what you just learned. Then apply it. Open your book, work through a case, and practice the rule right away. Now, let's talk about shorts. Short videos are not meant to replace real study. They are meant to be used as reinforcement. You can watch short videos anywhere and anytime. Use them to refresh rules, reinforce your memory, and stay connected to coding every day. One final reminder, passive watching does not work. Active learning is what helps you remember, apply the rules, and succeed on the exam. This is the final formula for success. Rules, consistency, practice, and reverse analysis. When you follow this roadmap, it doesn't just help you pass the exam, it helps you think like a real coder and prepares you for real-world coding. You don't need special talent to succeed. What you need is commitment, discipline, and the right strategy. If you stay consistent, practice the right way, and you reverse analysis, you can do this. This is the same roadmap I have followed since college, and this is the foundation behind my credential today. Before we wrap up, if you found this video helpful, please take a moment to like, comment, share, and subscribe to my channel. Your support truly means a lot to me and helps me continue putting the time and effort to create clear, practical lessons for you. Thank you for spending your time watching my video today. I wish you a new year filled with consistency, confidence, and success. Whether you are preparing for an exam, advancing your career, or just beginning your coding journey, keep going, stay focused, and I will see you in the next video. Until next time, have a great day.